So Maheer, let's go through some of the comments we're getting on Facebook from our ads.
Yeah, this is for the 3D printed veneers ad, right?
There's some pretty classic ones in there. I think my favourite so far has been referring to me. I was the one talking in an ad. You think he would have got his teeth done before sprouting this nonsense? I think it was, I replied to him, I was like, I didn't realise like the only prerequisite to being a dentist was having perfect teeth.
I've got the perfect teeth.
You do have perfect teeth. I just don't know, man. Like, I reckon it would be cheesy for me to have perfect teeth.
Oh, especially straight away.
If I just got this banging set of veneers, I don't know, like, it's part of my personality.
It'd take me a while to get used to, I think.
I reckon you don't need perfect teeth.
No, you don't.
I'm not pushing veneers on anyone.
Unless you find you're so insecure, you've got some insecurities, or you're just like not smiling, you can't express yourself, that's different.
If it's a problem.
I've never seen you not smile.
It's pretty hard for me. They do. These things can chew food. That's all that matters. Another classic one, must be desperate for customers, advertise on Facebook.
That's where we're doing everything. That's where you are, bro.
Dude, it's 2024. It's not 1994.
No more billboard.
TV's dead. Do you have an aerial at home?
Nah.
I just watch Netflix.
I refuse to watch
Stan, I don't watch TV.
I just go on YouTube, to be honest.
Right. Another classic one, $500 a veneer, that's just under a week's rent for some. I don't know what the relevance of that is.
Yeah, if you can't afford rent, you shouldn't be getting veneers.
Exactly.
That's what I reckon.
It's an elective treatment. Like,
I think it's the most elective treatment we offer, really.
It's purely elective. Like, if we're going to start comparing everything to the average price of rent, like, where does it stop? Another one, for the 3D printed veneers, rip off, $500.
Nothing else?
A porcelain, no further information. No, a porcelain veneer is $2,000.
That's a quarter of the price.
A quarter of the price.
What I want to know is how cheap do they want it?
I've got like a business, I've got to pay my staff. Like, dude, how are we going to afford a $20,000 printer that lets us do veneers in 3 days for a quarter of the price of porcelain? And charge any less than that, $50. It's insanity. Like, it's not a charity. Like, it's a small business.
I would love to start a veneer charity one day, though, but not necessarily.
There's people out there who would benefit from them. Obviously, it improves your employability and things like that. But just like anything in society, there's costs involved, and we're a small private business. We can't be handing these out for free. Otherwise, we just wouldn't do them.
Look, if it was a perfect world, I would do dentistry for free, just because it's fun and I can hang out with you and my friends. But I can't. I've got my loans to pay. I've got my student loans to pay. It's hard.
I mean, looking at our bank accounts after Christmas, a closed period, paying leave out, paying our loans off, it's grim sometimes.
Grim, it's painful. And we're a startup. We're a startup business. We started brand new, no patient day. Everything's fresh. Like, we're literally I feel like someone like Elon Musk grinding with a new startup, a new company.
Grinding away, and then old mate wants his veneers free.
$20.
All right, another classic one. Wayne says, breaking the bank is having implants or veneers in Australia.
It's true that it's more expensive in Australia. There's for good reason. One is that we're regulated so harshly. Like, we've got really tough regulation standards to meet, and they cost a lot of money for us to even achieve those standards.
Exactly.
And then there's registration fees and insurance costs, and those costs Balinese dentists don't really have those costs, or exactly cities, they just don't have to worry.
I mean, we're so regulated that, like, obviously when we do a case, we just want to do the best work we can for the patient. But in the back of your mind as well is that if this stuff's up, I'm in trouble here, because we've got a dental board that regulates us. The patients have some way to complain if something goes wrong. There's recourse if things don't go right and the patient's unhappy. If you would go overseas and say, a full mouth of implants in Bali now, prices have gone up a lot. You're still looking at $15,000. If you go and do $15,000 worth of implants and that just fails, who are you going to complain to? You're going to lodge a complaint with the Balinese dental board? I don't think it works that way when you're living in Perth.
I think you're quite a low priority for them.
I mean, at the end of the day, we don't want to touch anything that's been done overseas because we just don't know about the quality. And as soon as we touch it, we're legally involved. Okay, and that's where the problems come in. So when you're paying for Australian dental treatment, you're paying for accountability. Okay, you go overseas, there's no accountability.
I mean, there are good dentists overseas, but there's such a range. If you're building a house, there's the way you could build a house that lasts like 1,000 years or 20 minutes.
Yeah.
It's still building a house, right? You're just not going to call it a house. That's kind of what dentistry is like.
And when we see some of these cases come in from overseas, you don't even know how to tell the patient that the quality is just so poor. You don't want to break their heart, and it's tricky. It's tricky.
It's one of those things, you don't know what you don't know. So you think, oh, it's just teeth. But when you've looked in people's mouths for 15 years and you can see every way things can go wrong and how much pain is involved and how irreversible it is, that's when you realize, okay, if we're going to do dentistry, we do it once, we do it properly.
Exactly. So David says, I got 24 ceramic crowns and 2 extractions and a holiday in Vietnam for $9,000. Why come here? So I think the first thing I pointed out to David was, if you can't drink the water in a country, I don't know if I
probably don't do surgery there.
Probably don't do complex oral surgery there as well.
In your face.
I think that we described it to him in the comments as, it's like comparing Bintang, right? Like a cheap, fun overseas beer. You drink it when you're in Bali and it's cheap and it's fun, but it's not really how you want to approach your teeth. I think we sort of describe ourselves as being like the Penfolds Grange versus the Bintang of overseas dentistry, is that everything we do here is just, we put everything into it to make sure it's perfect, it's precise.
State of the art and latest technology, latest materials, biomimetic.
Yeah.
Gonna be healthy for you as well.
I think you've got the choice to do it, but I think, like we said to him, your teeth deserve better than basically the equivalent of like a budget backpacker's holiday. Right, like, these are your teeth. Look, you have the choice to do that. If you want to take that risk, that's cool. As long as you understand that there's significant risks involved.
And no one in Australia is really going to help you out and touch it.
Yeah, we want to. It's just that we need to be aware of our legal risk as well in getting involved in poorly done cases. And that's where we'll usually refer these off to specialists to deal with. And that's where costs really become significant. The remediation costs can be really significant.
Absolutely.